Hello and welcome to Filibusters and Fine Print, where AMGA's public policy team gives you the insider view on healthcare regulations and legislation. Thanks so much for joining us for the latest from Washington, D.C.
Welcome to Filibusters and Fine Print. We're back after a bit of a hiatus. My name is Darryl. I'm the Senior Director of Regulatory Affairs, and I'm joined today by...
Hi, I'm Lauren Latney, the Director of Government Relations at AMGA, and it feels very NPR right now.
It does.
Yes.
Yeah, we see that glass between us, and there's only two of us.
Yes.
Well, three, because Mike counts.
Mike is here. Yeah.
But the rest of the team is off on assignment.
Yes, that's what we'll call it.
Yeah.
Yes.
Yeah, exactly.
That feels more official.
I think so too.
Yeah.
We're back after a little bit of a break after annual conference.
Mm-hmm.
We were in Vegas.
Yes, we were in Vegas for annual conference, which was great. Probably one of the best ones, but I think I say that every year. I think I said that about Texas.
Yeah, they keep getting better and better.
Got to meet some wonderful new members who are joining, and they have such great ideas they were sharing during sort of one of the recruitment lunches. We got to go through almost like a science fair because they had the poster boards out in the hallway.
Those were fascinating to go through and see like some of the quality measurements and system improvements that they're working on. Really neat.
Yeah, and I the ones that I were cheering for, they got ribbons, so it took me back to high school science fair. And it was just
less paper mache.
Less letters that you get from like Walmart or like Michael's.
Yeah. It looked like everyone's put some serious work into it, not like, oh crap, this is due tomorrow.
Right, exactly. Which was how my science fair projects always ended up.
Yeah, exactly. So, but we spent some time in Vegas, and it took a couple of weeks to figure out. Once you come back from Vegas, I think you need a little bit of a breather. Yeah, we needed a breather. We hopped on a flight, a red eye, and then we got lost, for several months. And now we're back here. We have to go back.
We have to go back. Yeah. We have to go save our partners here who are on assignment.
Exactly.
Yeah.
So we're back in D.C., and it's like, wow, we've traded, the atmosphere in Vegas for the atmosphere in D.C., where there's a whole lot of finger pointing going on.
Finger pointing and humidity, I would say.
Humidity?
Yes.
Yeah.
The air is thick here.
Yeah. So there's been a couple of hearings talking about affordability and who's responsible and what's happening and how we're going to fix this. So, we're going to stick with the airplane analogy. 30,000 feet, we're looking down. What are we seeing? Yeah. Do we want to just keep flying somewhere else?
Well, so I'm always team let's fly somewhere else, but we'll just say we're in a long layover right now. We're going to keep this going. We'll see how long this goes. So we're in a long layover right now. Over the past, since the beginning of the year, the two committees of healthcare jurisdiction on the House of Representatives side, that is the AMGA Commerce Committee, who does whatever they want, and then you have the Ways and Means Committee, which is largely in charge of Medicare taxes, Medicare Part A, GME. They've been doing hearings around healthcare affordability. That is the buzzword of the moment. And so far, they've had hearings with healthcare insurance executives, and it's really fascinating to see all of the commercials that are now taking place.
Well, I don't care what your streaming platform of choice is in the DC area, or if you still have, I was told to take down my giant antenna because it's an eyesore, so I don't get over-the-air anymore.
It is, health insurance companies are like, we're the good guys. Not only we're the good guys, like everyone else is like terrible, and we're the only ones that's protecting you from this. And like, I was like, wow, whoever does their PR, they're getting paid very well to change the narrative.
Yeah, trying to shift the emphasis and focus on, like you said, where the backstop that's protecting you from even higher pricing and even longer wait times and that sort of thing.
Yes, basically kind of calling hospitals sort of subprime lenders and collectors, even though it's sort of like, well, who's paying the claims that lead to this?
Yeah.
But so they've been doing an excellent job not taking responsibility for their role in things.
Right.
And we also had larger hospital systems testify. We've had healthcare associations testify. We've had pharma companies testify. We've had supply chain companies testify. And so now we're back to the independent physician, the smaller practices, which happened last month in the Energy and Commerce Committee. And this one was a little interesting because of the fact that it was more of a solution-based hearing where you had independent practices talking to members of Congress who had some legitimate questions on how to improve our current payment system, which sort of ties into something we'll talk about a little bit later that's happening with the GOP and Dem-Doc caucuses who are working on a larger macro legislation. So clearly this hearing was supposed to tie in that work, because in order to kind of do legislation that's introduced in a committee of jurisdiction, like if you're doing healthcare stuff, you typically have a hearing to talk about the pieces of legislation here. Right now they're doing a little cart before the horse, because there's no official legislation out. But it seems like they're setting some sort of groundwork for some sort of end of the year conversation.
This was interesting that they're, actual solutions, actual policy, more than just, is this fair to say, more than just an opportunity to get, some clips or a talking point or, something for campaign fodder?
Exactly. What's fascinating, I'll keep this very broadly. There was an instance where a question was supposed to be a little bit more hostile, but the power of advocacy changed that, and it became more of what do you need? What are some problems that are happening in macro that are solution focused? So it definitely shifted the tone, which was really great for us, and also a little concerning.
How so?
It was a lot about how do you keep the independent independent physician practices. There seemed to be an underlying tone of concern around healthcare systems. And so we certainly don't want to pit certain things against each other. Our members are so diverse in terms of medical groups and healthcare systems that we certainly don't want to make an evil character out of one or the other.
Sure. So I think that's one of the challenges for us, for AMGA, the policy team, is to educate members of Congress, staff, these committees. Look, there's a right way and a wrong way of delivering care, but both of our, whether they're system-based or independents, they provide high-quality care to patients in need. There's a little bit of a different way of doing it, but neither of them is a wrong way of doing this.
Correct. It's really, especially the style of AMGA members, has always been this team-based coordinated care, which is slightly different than what we've seen with the independent practices, but it's something that we can talk about this a little bit later. We want providers to sort of strive toward, particularly if we're moving toward value, which is something that I think most members of Congress, I think there's bipartisan agreement on that. Yeah. Of course, it's always the devil's in the details.
How do you define value? Yes. What are we measuring? How are we going to pay for this? What sort of savings? Are we going to make this mandatory? Exactly. That's a whole other conversation.
Let's underline how we're going to pay for this, because that's always the big question of when Congress decides to do or not do something.
Yeah. Well, I heard there's a number floating out there, $70 to $80 billion.
Billion.
Yeah.
With a B.
Yeah.
Which is, I guess, where we are payment wise now. But if we're looking at sort of conversations around what a GOP or Dem-Doc caucus, which is on the House side, them developing legislation, they're willing to put forth, we'll pay this much money for an MEI adjustment, which is something that we've lobbied on. Most healthcare associations in the city have lobbied on. Doing a primary care bonus. How do we look at quality measures? How do we really change the way that we are doing our current payment system, because it is not stable. There's not an instability anymore as much as it was promised when we talked about SGR. And it's fascinating. We had our Capitol Hill Day last week, and there may be 2 staffers, 3 max, that understand what life was like before macro.
So just so our listeners understand,
yes,
how many people would you say work on Capitol Hill? I know it's kind of a...
Probably tens of thousands. Well, about 10,000 or something.
So 10,000 people.
Yeah.
And about 2 or 3 of them really understand what we're talking about.
They're writing the legislation in real time. So yes.
Yes. Okay.
Yeah, I think there's maybe 2 or 3 on the House side and 2 or 3 on the Senate.
Okay.
Yeah.
So all right. So we know at least it's a short Rolodex.
Yes. Short Rolodex
of who we need to talk to.
Institutional memory is very important, and it is shrinking by the day, I think.
Yeah. So MEI fix coming out of the Doc Caucus.
Yes.
So as exciting as that is, we're going to have to work with them to get their legislation through committee somehow.
Correct.
And that's a bit of a challenge too, because the Doc Caucuses are sort of their own institution. Is that fair?
Right. There are several members who are on the Energy and Commerce Committee. So there seems to be an interest by these committees to kind of look at this issue, but it's being written by GOP and Dem Doc Caucus, as you said, and so we haven't seen the full text yet of legislation, and that's supposed to be coming soon. And of course, members of these committees will have their own ideas of how this should be going on, or they might have their own pushback on some of the things that might be in the legislative text. So that's when the rumble starts.
Sure.
Yeah.
So all of this is going on. There's a congressional calendar to keep that keeps, it never stops.
Yes.
You know, we got midterms coming up. How do we keep MEI, you're going to like this, from being that one piece of lonely luggage on the baggage claim that gets left behind?
There you go. Yeah. We want to make sure that luggage is not just stuck in the airline terminal and hopefully someone will call and pick up the bag, or does it just stay there forever? So that is the real concern right now. We are looking at it. We are in June. We're at the middle of June. You probably have another month or so in terms of conversations and debates happening on the House floor in terms of how do you appropriate federal funding. And then in August, members of Congress go home. Hopefully we can set up some meetings that they can do tours of AMGA members' facilities. Congress comes back in September. They try to fund the government. It will not be funded in September. They'll pass a resolution to continue the current payment funding until the end of the year.
Because we haven't had like a budget passed through regular order since I think I was in high school.
Correct.
Yeah.
Yes. That seems like a fantasy. It's sort of like going on a reality show. It's like, I'm not here to make friends. Members of Congress are like, oh, I'm here to bring back regular order. That has not come back yet, but it's cute to say. Yeah. So you have that toward the end of the year. And in between that, you have the November midterm elections, which will determine who's going to be taking over the House and Senate.
All right. So a lot going on.
Yes.
And we've got all these competing forces with the overlay of the politics of the moment. So there's the policy going on, there's the politics going on, there's a time crunch going on. We're sort of stuck in the middle here. We're pushing our policies. We're trying to help the committees of jurisdiction develop policies that we support. Yes. We're working with the Doc Caucuses, so their draft legislation can maybe fit into something that's gonna not get left on the baggage carousel.
Correct.
And now we're gonna switch more to transportation. It's gonna catch a ride on a train and go
to the thing. But when you're flying, though, there's problems sometimes what's going on in the Sky Tower in terms of air traffic control. There are all these rules and regulations that are happening, and so there's also concern while we're having these conversations around payment stability of waste, fraud, and abuse.
Sure.
Which is parallel conversations now, I feel like, when it's happening. Because if you want to pay for something big, you're also really concerned of who are going to be the bad actors here. And so you're really seeing that, particularly in the Ways and Means Committee. Again, they do sort of the tax, Medicare portion of it. And a lot of concern around palliative care fraud that happened in Los Angeles. Yeah. A lot of concern around some of the things that have been happening in Las Vegas as well. This has been a real focus at CMS on fraud abuse. I know also Vice President J.D. Vance and a broader is looking at fraud throughout the country. And so with that, CMS is framing it as like making sure that beneficiaries continue to have this like as a benefit value, that this is not going to be taken away from them. But at the same time, when you're dealing with bad actors, you typically put more things in place where there's transparency, where there's more rules and regulations, which makes the good actors have to fall under these policies as well, which adds to the administrative waste, which is something I know you've been talking about a lot.
Yeah, it can get really frustrating. You get these headlines, and obviously it's a problem that you've got these bad actors. You mentioned the hospice palliative care issue, DME, and all that. But then it gets CMS, instead of taking a look at that they tend to take a broader view and bring down a hammer instead of using a scalpel, right? So you all of a sudden you've got like a 6-month moratorium on enrollments, or you can't even, change ownership. And I can appreciate the bind they're in. They're trying to be good stewards of the taxpayer dollar. And you have, frankly, criminals abusing the system. So that'll bleed over into other policies where they're trying to ensure that every last dollar is accounted for. And in and of itself, who's going to come out and say, like, that's not important? It's clearly important. How you go about protecting those dollars really matters, because it, to your point, will add to the cost and administrative waste that our members, the good actors out there, face. And you see something like this in the Wiser model.
Right.
This is not so much a concern about fraud, but they see it as waste in the system, low value care, things that do you actually need to be providing this care, and you're going to have members in the states that Wiser is, operating in, either subject to prepayment review if they want to opt out of this, so that's a headache, or, under this model, you've got technology companies, essentially reprocessing and reevaluating claims to make sure they meet local or national coverage determination. So that's a huge hassle for the members who are going to be subject to this. What starts in 6 states, if they can eke out some savings or point to, like, we saved Medicare, X amount, there's nothing stopping them really from taking this national. So what starts small potentially can expand both in scope, meaning geography, or the number and types of services that, the program will capture. So, one man's low value service, might not, our members might disagree with that. So that's sort of where that stands right now. But it makes for good, television,
right? For good governance conversations. Yeah. So it's like an interesting juxtaposition, right? So we have these. When a committee is voting on legislation that they have been discussing internally, they have something called a markup. And so they are basically adding and amending these bills that are coming out of the committee that have been introduced by these members of Congress. And we're seeing a lot around, like, making sure there's additional transparency with Medicare Advantage and encounter data, checking on data brokers who sell Medicare Advantage, some more transparency in terms of palliative care, in terms of DME, like 340B, all of these sort of what could be good governance bills, but also are increased administrative waste bills for good actors and anybody participating in the Medicare program. At the same time, you have something, as you mentioned, like the Wiser model, where you're having members of Congress in those 6 states do something called a Congressional Review Act, which essentially is, okay, we're going to look at this administration rule and see whether that actually was something that should have been done by Congress or that something could be done by the agency. It was determined that this was overreach by the agency's part, and so Congress will vote to say, basically say, no, this shouldn't go forward. It's largely going to be symbolic. Right. You've also seen in the House Appropriations Committee where they are stripping funding for Wiser, even though that's still a long process. So you're seeing these symbolic votes by these members of Congress who note that all this administrative waste, while it seems like they're trying to be good actors here, there was overreach. There was not enough congressional oversight here in terms of what this should be shaped like in terms of legislation, while at the same time voting for legislation that increases sort of the same thing.
Yeah, it's like, here's this huge problem, do something about it. And then like, well, not that, Mm-hmm. So exactly. You got to fix this right now. Well, not like that.
But not like that.
Yeah.
Yeah. That's why we keep busy at AMGA, the lobbying team, because a lot of it is not like that.
Yeah, not like that. Not like that. I like that. So you said they leave in August.
Right.
How excited are you?
It's always something, right? Like, so they're leaving in August. Largely, it's going to be campaigning. It's going to be hopefully meeting with AMGA members. It's going to be taking tours. It's going to be shaking a lot of hands, kissing babies, going to state fairs. But that leads leaves us a small amount of time to pass what could be legislation that could stabilize the Medicare payment system.
Yeah, I think I'm cautiously optimistic based on the conversations that we've had. I've been lucky enough to be part of these conversations on the Hill, which has been really illuminating for me as a regulatory guy to see how this works. It's been a minute since I've been on Capitol Hill. But to your point, like, is this going to get wrapped into a larger package? Are we going to have like an end of year fix?
Will this plane land?
Will this plane land?
Will this plane land? That's always the fix. So, right now we're waiting for legislation to come out from the GOP and Democrat Caucus. Like, the lawyers who write the legislation for members of Congress are typically swamped because they're always writing legislation. So we're waiting to hear back from that, which, again, if this happens at the end of June, you're still having a tight timeline. Not to mention, these have to be considered by committees. These have to be marked up. These have to be voted out. But it is excitingly probably the last time we've seen legislation that will do payment stability that has been this comprehensive has been macro.
I think so.
It has been a decade.
It's been a decade since we really seriously looked into this. And to your point, the folks who wrote that, they're off doing whatever their next calling in life is, because it's not writing.
It's not writing anymore. So it's positive to see that there has been such interest by these caucuses in doing something around it. My fear always is, Congress isn't passing big packages anymore. The last time, one that stands out to me was the One Big Beautiful Bill Act, which was massive. Yeah. There's another reconciliation that's smaller around Homeland Security, but like huge bipartisan, let's get it all done. It's harder and harder, right, particularly because members of Congress are cognizant about what looks good for them to get reelected. So my fear is that we don't see a large package at the end of the year. We'll see these broken up into small pieces. Hopefully they can address the MEI, which has been, something that we've been talking about for a rather long time. But I think it's really up to AMGA members to continue to push their members of Congress to talk about the importance of this and why something needs to be passed. Not only because it would provide stability in the payment system, but then it'd be one less thing that they have to talk to members of Congress about.
Yeah, I can imagine, members of Congress and their staff would love to not have to talk about this. Mm-hmm. So I think one of the solutions for them is like, well, if you enact this,
right,
it solves that. You can check that off your list.
Yes, and we can bump up all the other things we have concerns about on the list.
Yeah, exactly. The rest of our task force report and some of the other priorities that we're talking about. Yeah. So fascinating. Yeah. Very cool. All right, so anything else you think you'd like to add, or anything we haven't touched on yet that...
Yeah, I think, by the time this recording comes out, it'll be 2 weeks since our Capitol Hill Day, which I found to be extremely successful. We had over 50 AMG members throughout states throughout the country come and lobby on our macro task force recommendations. We've talked to committee staff with this. Also, our issue briefs of issues of concern regarding telehealth, regarding GME, all of these things. And so it's always imperative to continue those conversations outside of the one big day that members of Congress, that AMGA members come to the Hill. And so we're always advocating for you to tell your story, to serve as a witness on how these policies affect you directly and how these policies direct the massive amount of employees that AMG members employ in these districts. And so happy to connect you through the district advocacy program, through our grassroots program. I've been saying let's do 1, 2, 3s. So 1, have a member of Congress tour your facility. 2, do a couple of meetings. And 3, send some grassroots letters to your members of Congress throughout the year to express your concerns and like your support for bills and legislations that directly impact you. And so we want you to do your 1, 2, 3s with us.
Sounds great.
Yeah.
I think TSA had a 1, 2, 3.
They did.
Yeah.
Oh, I think it was in terms of like bottles
bottle
and things.
size.
Yes.
Yeah, exactly.
Yes. So keep it on theme.
Pack appropriately.
Yes.
Don't forget your bags.
Yes.
There might be some turbulence.
Yes.
But we will get through this together.
Yes. We want to land this plane so that we have more stability in the system. And with that, we need your help.
Sounds good. Yeah. So thanks for listening. I know we had a bit of a delay, but I think our, scheduled flights are coming back.
They're coming back.
So,
yeah.
Stay tuned for more.
Exactly.
Continue to fly with us.
Yes, please.
With that, thanks so much for listening.
Yes. Have a great day. Thanks for joining us for Filibusters and Fine Print. This podcast was brought to you by AMGA. For more information about AMGA's advocacy efforts, visit amga.org/advocacy.